Thank you for joining me today. In this video, you will learn how to interview children. Psychiatric interview. Children are not small adult. Their interview assessment is to a developmental approach, and you will assist the parents. You will assist the family as a whole. You will gather the assessment from the caregivers, parents, teachers, school, and other resources. Psychiatric symptoms present often as behavior or developmental issues. You must assess the child and the family system and establish a report with the child first and avoid prematurely siding with the parents. Always consider normal development variation versus pathology. So the interview structure include interviewing parents and caregivers, interviewing child and teenagers, interview joint family discussion when it's appropriate, collecting information resources from school, medical record. Teenagers interview assessment include mood, substance abuse, sexual activity, suicidal ideation, and abuse. Confidentiality and consent. You will explain a limitation of a confidentiality clearly and early. You want to explain to them the mandated report for the child and teenagers and the family. You will explain to them that you will report the abuse, neglect, danger to self or others, and you cannot keep the confidentiality for those reasons since you are mandated report. Teenagers may be withhold information if the confidentiality is unclear. So they may not talk to you or keep some information if the confidentiality is not clear. You will assist the developmental and you will consider developmental variations. Symptoms must be interpreted in a developmental context. Consider a cognitive development, language ability, and children may not develop fully cognitively wise. Their language ability may not develop yet. Emotional regulation is they may not develop their emotional regulation. Does not mean they are having a mental illness or psychiatric issues or episodes. Social contacts. People are different social wise. Immaturity is not equal psychopathology. Immaturity is not equal to psychiatric episode. You will gather children pediatric history. Children, you will identify the information, their age, such as their age, their grade, their school placement, referral resources, and the reasons. You will also gather history of a present illness. You will assess onset of the illness, duration of the illness, progression of that illness. We are talking about this video. In this video, we are talking about psychiatric illness. You will set in the special when do that happen. Is that happens in school or in school or home? If they are depressed, if they are anxious, when do that happen? Prior interviewing and response. You will consider the prior intervention and response of the intervention. You will also assess pregnancy complications when the child was in their mother's womb. Do the mother use substance? Do the child being exposed to drugs or substance or alcohol? History of prematurity. Do the child born premature? Do they have a hypoxia when they were in their mother's womb or when they were getting birth? You will assess their developmental milestone, motor, language, and social. You will assess past psychiatric history, prior diagnosis, hospitalization, therapy that they went through, medication that they had before, behavior interventions, suicidal attempts, self-injury, aggression. You will assess the teenagers and the children about the past history. And then you will assess the medical history. If the child or the teenager have chronic illness, do they have a seizure? Do they have a hair trauma? Do they have sleep disorder? Are they taking over-the-counter medication? Do they have sensory impairment like hearing or vision? Do they use glasses or hearing aid? Family history. You will assess family history, extremely important. You will assess the mood disorder in the family. If the family has bipolar disorder, if they have a history of ADHD, you will assess autism if the family have it or the siblings have it. Substance abuse disorder, you will assess that if the family, parents, or the other siblings have that. If they have violence or suicidal ideation, you will assess family function and parenting style. You will also assess the social and environmental history. You will assess family structure, attachment pattern, school performance, peer relationship, teenagers' peer relation, bullying, victim or preparatory behavior, trauma exposure. You will assess trauma exposure. You will assess foster care or CPS involvement. You will assess social and economic stress of the family and the teenager and the child. You will also assess mental status examination for the child and teenagers. You will assess the appearance. Are they groomed well, developmentally appropriate for their address, behavior, level of activity, eye contact, coordination, speech, are they articulating, rate of the speech, volume of the speech, language development, if they are developed compared to their age. You will assess affect and mood, congruency, range, reactivity. You will also assess the thoughts process. Younger children may be concrete or elaborate. Thought context. You will assess the fear, obsession, machination thinking. You will always assess if they have SI or HI. You will assess their perception, imaginary friends, if they have imaginary friends, normal in youth children. That is normal youth children to have imaginary friend. It's not psychiatric episode or hallucination. You will assess if they have a real hallucination. You will assess the context carefully to separate between imaginary friends that is based on developmental, that the normal teenager is younger child have, or if this is psychiatric hallucination. Cognition, you will assess the attention, memory, academic function. Insight and judgment, you will assess age appropriate expectation. Pay attention or observation. Critical in a younger child. Play behavior profiles insight into emotional conflicts, trauma, cognitive development. Observe, separate from the caregivers in context of a pattern. Fraction or tolerance. You will assess folks by the age. You will assess preschool for their developmental delay, attachment disorder, autism spectrum, disruptive behavior. Those are the behavior you will assess a preschool child. School-age children, you will assess if they have ADHD, learning disorder, anxiety disorder, opposition behavior. Teenagers, you will assess if they have depression, bipolar, substance abuse, eating disorder, self-harm. You will assess that for the teenagers. Risky assessment is always mandatory. You will assess suicidal ideation, intent, if they have intent or if they have a plan. Self-injury, you will assess that. Aggression toward others, you will also assess that. Absence or neglection, you will assess that. School violent risks. Differential diagnosis include normal development versus pathology, ADHD versus trauma versus mood disorder, autism spectrum and language disorder. You will conduct disorder versus ODD. You will assess depression versus attachment disorder. Some of the rating scales that you will use commonly will be Vanderbilt and Connor's scale that you will use when you assess ADHD. You will use CBSL, Children Behavior Checklist. You will assess PHQ-9A for teenagers. You will use a scale for anxiety, GATE 7 scale. Autism screening tools. You will use those scales. Those are the common rating scale used for teenagers and children. Formation and treatment plan for teenagers and children. You will integrate child factors, family system, school environment. Treatment often include psychiatric. Psychotherapy is the first line. You don't want to just start with psychiatric medication. You want to begin with psychotherapy first. Parent management trial, school accommodation. You will do school accommodation. Medication when indicated. You will use only medication when indicated. You will involve caregivers in all planning. You will provide psychoeducation regularly to the parents and to the children, to the teachers, anybody that involve care of the child and teenagers, like teachers, caregivers, parents, social workers. Always interview children, teenagers. Multiple information are essential for diagnosing a psychiatric diagnosis. Developmental context determines if this is pathology or psych. Behavior symptoms often mask anxiety and depression. School function is the key diagnostic data point. So you will collect it from the school also. Thank you for joining me today. I would love to see you in my next video. Please subscribe and thank you.